Chinese President Xi Jinping says that there's a need to mend the loopholes exposed in the coronavirus outbreak. This comes as a growing number of frontline medical staff in China have contracted the virus. More than 1,700 healthcare workers have been diagnosed so far, and 6 of them have died.
The majority of the infections are among medics in Wuhan, the epicenter of the outbreak, where there's a major shortage of protective gear. Doctors are said to be seeing patients without proper masks or medical gowns. The death toll from the epidemic in China has risen to 1,380 and nearly 64,000 people are infected. Our correspondent Olivia Seong has been following the developments. She joins us live now. So, Olivia, how are authorities improving the protection for these frontline medical staff then?
Well, we've seen the reports of how there's been a shortage of protective gear in hospitals. We've also seen the reports of medical workers having to work very long hours because they've just been overwhelmed with the number of patients at the hospitals. And officials today at a news conference say that this has to be addressed and measures have to be put in place. And this also comes as we've heard Chinese President Xi Jinping say that ensuring the safety of the people is a major task for the Communist Party, and that there is a need to make up for shortcomings and plug loopholes that have been exposed in the outbreak. We have to remember that we have seen public anger over what has been perceived as a mismanagement of the situation, a downplaying of the severity of the situation, especially in the early days of the outbreak. And now we're hearing President Xi saying this. He has also stressed the importance to roll out a biosecurity law as soon as possible. And this marks a change in his comments. Previously, we had seen President Xi say that there have been some positive developments in the situation and epidemic control efforts have had some hard-won results. But we do know that one of the issues in protecting the healthcare workers, and authorities say that, they have a heavy load, the working and resting conditions have limitations, and they're under a lot of mental pressure and are at high risk of infection. So what is being done to help them includes improving their work and rest conditions, including spending money on equipment and protective gear, building facilities to minimize their exposure, even renovating on-call rooms or doctors' rooms, protecting their physical and mental well-being, ensure that they get enough rest and shifts are rotated, remuneration. There will be temporary benefits for those on the front line, one-time performance-based wage for institutions with heavy tasks and at high risk. And for those who have been infected or died, unfortunately, from the infection, they will be compensated as well. Have a listen.
那么，我们国家卫生健康委对此高度重视，专门印发了医疗机构内新型冠状病毒感染预防和控制的一个技术指南，还有一个是关于加强重点地区、重点医院发热门诊管理和医疗机构内感染防控工作的通知这样一些相关的文件，在强化各项感染措施落实的基础上面。 专门对医务人员个人防护、关注医务人员健康等提出的要求。
Olivia, there are many questions now about this new diagnostic method that's being used. It's resulted in many more infections being registered. It's only being adopted in Hubei province right now, as we understand it. Why is that?
Well, what we do know is that Hubei province is the most badly affected by this epidemic. It's the epicenter of this outbreak, especially Wuhan city, which is located within the province. We know that medical facilities there are stretched, and previously using lab tests to confirm patients has resulted in probably underreporting in the number of confirmed cases. And this new method gives doctors greater discretion in identifying cases through patients' symptoms as well as through CT scans. At a news conference today, officials clarified that this new way of diagnosing patients is not necessary to confirm infection, but they've just added a new category of clinically diagnosed patients to the statistics, but what it does allow them to do is to give these patients treatment at a much earlier point in time, because previously these lab tests took time to make the confirmation. Also, it said that it's helpful for patients because they can get the treatment earlier, and experts, when asked whether or not this way of identifying patients would be used in provinces outside of Hubei, basically around China, the officials said that it would not be adding this category other provinces for now, but this, doing this would give a better reflection of what is happening, especially in Wuhan, which is really the main center of outbreak at the moment.
Olivia, thank you very much for that update. That was our correspondent there, Olivia Xiong.